Welcome to my YouTube channel. It's Sister Anibel Enes from Zambia. If you're a new subscriber, thank you so very much for subscribing to this channel. If you're a returning subscriber, I said thank you so much for returning. Hope you're enjoying the information you're getting from this channel. And if you're just watching, you've not subscribed, please can you subscribe? Turn on your notification bells. Don't forget to share. Don't forget to invite others. Don't forget to drop comments if you need any clarity or you have any questions. So, without wasting your time, today we are going to discuss the 4 stages of labor. Yeah, we are discussing labor. I know we've seen a lot of people with pregnancies. And then if you're a mother, I know we've experienced this. If you're yet to be the mother, I want to teach you what to expect when labor starts, or what will make you know that you are in labor now. Or the process from stage 1 to stage 4. Yes, labor has 4 stages. So if you only learned 3 stages, if you're a student, you only learned 3 stages, I want you to stay tuned, watch this video up to the end so that you know the 4 stages of labor. So without wasting your time, we are going to begin. Labor. What is labor? So labor is defined in a very different way. The process of the fetus leaving the uterus, yeah, that's labor. The process of the fetus and the placenta leaving the uterus, that's labor. So there are signs, cardinal signs and symptoms that will show you to say exactly you are in labor. One of the symptoms, we're going to talk about the strong and regular contractions. So the person in labor will have the strong and the regular contractions. So your abdomen will just start paining. You just know that maybe if you are 32 to 34 weeks, just know that you are in labor. Then there will be pain on your belly and the lower back. So you will start having pain on your belly button, on your belly and the back pain. So if you start feeling that and you are 32 to 46 weeks, 32 to 42 weeks, just know that you are in labor. There can be also discharge, which is bloody mucus, which is known as bloody show, yes, or water breaking, which is the amniotic fluid. If you see water coming out, just know that you might be in labor. So we're going to talk about the 4 stages of labor, which is stage 1. Stage 1 has 3 phases. There is the latent phase, the active phase, and the transition phase. And then stage 2, we're also going to talk about stage 3. And lastly, we're going to talk about stage 4 of labor. So, we begin. Stage 1 of labor. What happens in stage 1? So this is where the cervix dilates from 0 to 10 centimeter, and this stage contains the 3, which is the latent phase, the active phase, and the transition phase. The goal of this phase or this stage is to make the cervix to dilate from 0 to 10 centimeter and 100% effacement. So effacement is a thinning of the cervix, and dilatation is the opening up of the cervix. So dilation and effacement. Yes, that's what's happening. So in this stage, the fact that you should note, it's a longer stage, especially to prime gravidas. The prime gravidas are new mothers. Yes, those people are going to be the first time mothers. So it's the longest phase for the prime gravidas, and it intends to start when the true labor starts. So it starts when the true labor starts. So the latent phase, mostly the dilatation will be 1 to 4 centimeters and thin, and then the contraction will be the contractions will be every 5 to 30 minutes and the 30 to 45 seconds in length. So every 5 minutes you have the contraction, like do 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 do. Yeah, 5 to 30 minutes, and then they are going to last to 30 to 45 seconds. The contractions will start with mild contraction, then they will be moderate, then they will be tense, especially when you reach the transition phase. The contractions will be tense. Then mostly the woman in this stage won't even know what is happening, because they will just start, okay, I'm feeling the belly pains. Yeah, my belly is paining, I'm having a backache, and then they'll stay home until when maybe one of those symptoms, maybe they see the show or the water breaks, that's when they are going to come to the hospital. But if they're already in the hospital, yeah, you just need to, the nursing intervention, you just need to comfort this patient, because they really don't know what is happening, but they are having mild contractions that are occurring every 5 to 30 minutes. So you comfort this patient. You can tell the woman to be calm, but because this stage the woman is nervous, they'll be talking, they'll be asking questions. So sister, what is going to happen now? What? So you calm the patient and then comfort the patient, explain to the patient what next will happen to this mother. So that was the latent phase. So the active phase, in the active phase, the dilatation will be 4 to 3 centimeters. In the latent phase, it was 1 to 4 centimeters, and now in active phase, the dilatation will be 4 to 7 centimeters every 10 minutes to 1 hour. So the cervix here will be dilating every 10 minutes to 1 hour. The contraction will be every 3 minutes to 5 minutes. So the contraction will be every 3 minutes to 5 minutes and 45 seconds to 60 seconds long and stronger. So there in the latent phase, they were mild, but in here they are going to be strong and long. So in this phase, it lasts about 4 to 8 hours. In the active phase, it's going to last about 4 to 8 hours. It may also take time. It may be time for a mother to go to the hospital. If the expecting mother is at home, when you start having these strong and long contractions, it's time for you to pack your bags and go to the hospital. Yes. So during this phase, the water may break. Yes, the water may break, and the mother wants, if the water breaks when you are home, when you come to the hospital, you have to inform the nurse to say, my water broke, and then the nurse will ask you what was the color, and then you have to describe the color of the water that came out, because the normal color is supposed to be yellowish, brownish, greenish fluid. So if the water broke, you are supposed to tell the nurse to say, okay, water broke, so that it will alert them to check the fetal respiration, because it can make the baby to go in fetal distress, and if the baby aspirates that water, it can cause some infections, yeah, in the lungs. So you tell the nurse to say, okay, water broke. So caution in this stage, please. That's where a lot of African mothers will give their children an African medicine to activate or to fasten up the process. Please do not do that, because in as much as you want your child to be out of pain fast, it brings some complications to the fetus inside. It brings some complications to the baby who is yet to be born. So please don't do that. Let the normal physiology take place. Let the normal physiology take place. So in active phase, nursing intervention, you as a nurse, you're supposed to teach the patient, you're supposed to comfort the patient, praise the patient, tell the mother to say, you're going to do it, you can do it, look how far you've come, you can do it. You need to encourage this mother, especially whether it's a prime gravida or it's multiple mother. You need to comfort them. You can do the massage if you're not busy. You can do the massage to this expecting mother. You can teach the mother how to breathe and how to push. When the time to push comes, you can teach the mother how to push. Say, okay, so when time comes, when you have the contractions, that's when you push. When the contractions stop, you don't push. So you teach the mother, interact with this expecting mother, and be nice. So that is in the active phase. So now the contractions are long and very strong, and the baby starts to descending. So from the active phase, we go to the transition phase. So in the transition phase, this stage leads to stage 2. Stage 2 is where the baby is born now. So the transition phase, the cervix will dilate from 8 centimeter to 10 centimeter in the transition phase. And this phase is the shorter phase, but it's very intensive, because in this phase it will last 30 to 2 hours, and then the contractions are intensive, long. They might be back to back every 2 to 5 minutes, and they will last to 60 to 90 seconds length. The mother will be unconcentrating, pain. When you're in pain, you can't even hear somebody who is telling you to keep quiet if you are shouting. So the mother will be in pain, the mother will be irritated, the mother will be shouting, the mother can even start shivering, because now the contractions are back to back. So you can see a pressure coming to the rectum, maybe even the presentation of the baby, the presentation part of the baby. If it's the head, you see the hair, you see the pressure in the rectum there. So you tell the mother, the nursing intervention, you tell the mother, although not to push, for as long as the cervix is not fully dilated, you tell the mother not to push, because if the mother starts pushing, this cervix will swell, and when the cervix is swollen, it will fail to contract. It will fail to dilate properly. So you tell the mother to say, I will tell you when to push. So that's what happens in the transition phase. So you keep checking the vital signs to the mother and the fetal heart rate every before the contractions and after the contractions. You want to know how the baby is breathing. So you check the respiration, the heart rate of the baby, and then the blood pressure of the mother. So once you do that, that is when the baby reaches the vagina there, the crowning takes place. Then we moved from stage 1 to stage 2. So stage 2 of labor, this is when the cervix is fully dilated and infest and ends after the baby is delivered. So in second stage of labor starts when the cervix is fully dilated and ends when the baby is delivered. So in this stage, you will see the baby descending, and then the presentation part of the baby. That's what you will see in the second stage of labor. Then the contractions will be very painful, 60 to 90 seconds length, and every 2 to 3 minutes. So your nursing intervention now, you tell the mother, this is when the cervix is at 10 centimeters. So you tell the mother how to push, when to push. So you tell the mother, okay, position yourself, you position the mother, and then when the contraction starts, you tell the mother to push. So you will see the perineum, and then the anterior birth of the baby, the presenting part. If it's the head, you see the head. If it's the buttocks, you see the buttocks. So you see the presentation of the baby. So stage 2 is very short because you just see the baby and you tell the mother to push. So when the baby is born, this leads to stage 3 of labor. So stage 3 of labor, it starts with the fully delivery of the baby to the delivery of the placenta. So after the baby is born, the other nurse will take the baby, wrap the baby, wipe the baby, clothe the baby, and put the baby on the resuscitator, which is warmful. Yeah, and then the third stage of labor starts to this mother. The third stage of labor is the delivery of the placenta. So the delivery of the placenta is supposed to last 5 to 15 minutes long to prevent the risk of hemorrhage. Yes. So, and to prevent the risk of hemorrhage and the retaining placenta. So the signs of the placenta is how we are going to see that the placenta is supposed to be delivered. The umbilical cord will lengthen. So when the baby is born, then you clamp, and then you cut, and then this other umbilical cord is going to lengthen, and then there can be splash of blood. Those are the signs that the placenta is supposed to be delivered. Then there will be change in the uterus. If the uterus was oval, and then it's going to be globular shape. So the change of the uterus from oval to globular shape, it's a sign to say the placenta is supposed to be delivered. So the mechanism, the delivery mechanism of the placenta, you need to side as the placenta first. You need to know the sides of the placenta. So the shiny part of the placenta, that's the side of the baby, and the rough part of the placenta, that's the sign for the mother, the side of the mother. So the shiny part of the placenta is the side of the mother, and the dull darkened side of the placenta, or the dull red rough, is the side of the mother. So your nursing intervention, you monitor BP before and after the delivery of the placenta, and to prevent the risk of hemorrhage, and then you administer oxytocin, yes, after the delivery of placenta to prevent the risk of hemorrhage. And then you are going to assess the placenta. Is it fully intact? So on the attachment of the mother, the placenta has some lobes. So you check if all lobes are there, then the placenta is fully intact. If there is one missing lobe, then you go back in the uterus to check for any retaining. And then you're also supposed to check for the cord of your placenta, if it has 2 arteries and 1 vein. So you look at the placenta, and then you check for 2 arteries and 1 vein. And then you are going to make the mother comfortable. So you clean the mother after you've checked your placenta is intact and there are no retainings there. So you clean the mother, you remove the soiled linen, and then you encourage the mother to child bonding and encourage the mother to breastfeed. So once you've done that, and then there is no PPH or postpartum hemorrhage, the mother is fine, then we move to stage 4 of labor. So in stage 4 of labor, this starts with the 1 to 4 good hours after delivery of the placenta. So sometimes you can deliver the placenta and everything is okay, and then 1 hour to 4 hours, the mother starts bleeding from nowhere, So you monitor the mother, you make sure the mother is in a good health and she's not at any risk of losing any blood or of having any other infections. You ask the mother how often is she changing the pads, if the blood is moving in quantity, or she's changing the pad every 2 pads every 5 minutes. Just know that the mother is bleeding and you need to call for help. You call for help. You can't do everything by yourself, but you call for help. That's the postpartum hemorrhage, which we say PPH, help. Yeah, you have to call for help. And then you have to see the fundus of the uterus. Is it firm, mouth line, near or at the umbilicus after birth? So you see the uterus, is it contracting? Yeah. Is it firm? Yeah. So you check for those. And if the bonding with the mother and the baby, is the baby breastfeeding or grasping, you check, make sure the mother and the baby, they are well before you discharge them. So that's all about the labor. If you're expecting mother, expect to go through these 4 stages of labor. If you've given birth before, you're watching this video, please tell that grandchild of yours or that daughter of yours who is expecting to watch this video, so that she knows what she will go through. The pain is real, but by Almighty, everything will be okay. So from me to you, it's bye. And don't forget to subscribe. Don't forget to turn on your notification bells. Don't forget to like it. Don't forget to drop comments if you want any questions, or you need any clarity, or you want me to present a certain condition that I've not yet presented on this channel. This channel is created for us to know the diseases, for us to know what goes wrong in our body. So please don't forget to share this video. From me to you, it's bye, and God bless you.